The Minnesota Electronic Health Library will benefit many people across our state, from the healthcare providers who need to have access to the best evidence on which to base diagnoses and treatments, particularly in rural settings where they cannot afford these costly resources, to our students who are training at over 35 institutions and need to learn how to search for the best evidence and critically appraise it and apply it in a clinical setting, to our caregivers. There's 600,000 caregivers in our state, and they too would have access to these types of resources. They're easily searchable and understandable. And then, of course, it would apply to everyone in our state, all 5 million citizens.
I think a program like this is just so critically important. I think that providers, whoever they may be, it could be primary care physicians or specialists, it could be nurse practitioners, physician assistants, those of us who are providing care have expanded in so many ways. But the thing that hasn't changed is that we all need good, up-to-date, current information. For current, truly relevant information, it needs to be online. We all need to have access to that. And I think that for those of us like me who are at the University of Minnesota, that's never an issue. But there are hundreds and frankly thousands of providers across the state who don't have that kind of access. And it creates a certain level of disparity.
Evidence-based practice has just exploded, and that the opportunity for dentists who are basically siloed in their offices in even urban communities and in a metro area, the opportunity for them to interact with the highest level of scientific evidence in the care of their patients is what's really exciting about this program.
We have students in both rural and in our urban settings. Even though we are an alliance, there is not equal access to resources within the library for all of those students.
And as an educator, when I have a student with me, I want them looking up cases. They've seen a patient with a certain condition. I want them to do more than just tell me the symptoms, but let's look up what the latest information is about this condition. And having a program like this available to them, no matter where they are, whether it's at a large urban county hospital or a very small hospital or clinic in very rural Minnesota, they should all have equal access to that.
Being able to offer this support and service to the rural areas will give those practitioners, both medical and nurses and other healthcare providers, immediate access to up-to-date information that was not accessible to them before. It will provide an incentive to remain in those healthcare areas as well and promote a good practice.
Health disparities exist because the patients that have access to great academic health centers will have access to a greater array of treatment options and a greater depth of knowledge. But with the ability to have contemporary information everywhere, the rural patient doesn't have to travel. The information can travel to the patient and to the doctor in their communities.
It's probably more common than not that patients will come in already equipped with questions because they've found things online. And often as not, that information isn't very good, and all it has done is ramp up or amp up their anxiety. I would love to have the ability to steer them in a direction so that I know that the information is evidence-based, that it has been vetted, that it's really good, solid information.
We're seeking funding from the legislature because we think that the Minnesota Electronic Health Library would be a great benefit to the entire state. We believe in equal access to high-quality, reliable health information for everyone.